right. In Module 3, we're going to be looking at our intervention strategies. This is where we're going to identify and develop intervention strategies to help prevent, reduce, mitigate the risk involved. In the previous module, we assessed our communities. We did our community risk assessment. We looked at objectives. We looked at the priorities and how we can prioritize the different risks or hazards in our community. And then we ended up that unit with some objectives, goals and objectives for our community risk reduction program. And so in this particular module, this is where we identify how we're going to reach those objectives, meaning the strategies that we're going to use and that we're going to implement to reduce the risks and provide for mitigation of those risks. So this is another one of those important units, and I just kind of want to walk through this a little bit as we go through here. You have your piece to read and the 5-step process book where you identify your interventions. You're going to I think step 2 and step 3 are together in this particular module. Create an intervention strategy. So be sure and read that. It's about team building, and finding team members is a part of that. And then when we talk about risk reduction, there's different levels of prevention and different aspects of prevention and mitigation that will enable us to reduce the risk. So we talk about the different levels of prevention: primary prevention, secondary prevention, tertiary prevention. There's a short reading on those pieces, as well as I believe the short mini lecture covers it as well. Because then we talk about the different types of interventions, the different areas where we can intervene, whether it's through education, whether it's an engineering initiative, whether it's an enforcement initiative, whether we can use an economic incentive to help reduce that risk, or whether we are going to use our emergency response capabilities to reduce the risk and increase the safety of the people that we serve. And so those are some of the different categories, types, levels, whatever you want to call them, of strategies of areas where we reduce the risk. And then you're going to look at something called Haddon's Matrix. I don't want you to get bogged down in Haddon. We could do a whole unit on Haddon's Matrix. This was borrowed from the area of public health. And Dr. Haddon, where we see it most of all, is using Haddon's Matrix as vehicle crashes or injury prevention, that type of thing. I posted a couple of examples in your resources section that have used Haddon's Matrix to develop their plan. I think there's one on dog bites and one on vehicle crashes, and I can't remember what the other one was on at this time. But it is a viable thing. Haddon looks at the different areas, as well as the pre-event, event, and post-event. And then the different factors, and you create this matrix of where you think about an intervention as if you have the steps in a process, it's where you got step 1 and 2, and where we intervene in the middle of that is where intervention comes in. So where could we modify, adapt, educate for the pre-event piece of this with human factors or equipment factors? Environmental factors, and then during the event, an example of vehicle crashes. When we talk about seatbelts, wearing seatbelts is a type of an intervention, and it's not a behavioral one. It is in the sense that people have to fasten them, but it's also it's environmental in that it's built into the car. And then the event. During that crash, maybe the airbag is another one of those factors. So, looking at the pre-event, event, and post-event factors that can help mitigate or prevent the damage that has occurred. So read some of that information. Like I said, there's several resources in the resources and references section on Dr. Hatton. And this is a concept that kind of gets us thinking a little bit. I've asked that there's a sample matrix, blank matrix on there as well. And I've asked that you kind of take your risk issue, whether it's vehicle crashes, gun problems, uh, residential fires, wildland fires, whatever your risk topic is in your community, and try to fill out Hatton's matrix based on that. Like I say, don't get bogged down, but it's a thinking tool, and it spurs thought, it spurs innovation, thinking outside the box. Another piece to look at that Dr. Hatton came up with 10 countermeasures. And again, don't get bogged down in this, but I think it's all good information to know when we talk about preventing and mitigating the damage from fires and injuries, accidents, whatever you want to call them, to try to keep people safe. So then we start talking again. Remember, we talked about acceptable level of risk. And so we talk in this section a little bit about cost benefit. At some point, I want to get our accounting professor to do a short video about cost benefit because it is something that is applicable. It always made me very sad to think that cost benefit, we were talking about people's lives, but I understand the factors, how much of the cost are people willing to bear, whether it's for equipment for your department or whether in their own lives, how much expense am I willing to go to? So we're going to be looking at cost benefit analysis and some of the basic assumptions of cost benefit analysis, even as it applies to fire and life safety issues in injury prevention. The next topic down in this module is it's actually a chapter from a book, but it is linked through Galileo. And it's titled Fire Prevention Personnel is the kind of the title of it, but it's how it is a good example of a risk reduction plan. I had an opportunity to work on a project with Shane Diekman from the CDC, and many of you your fire departments or your communities may have been the recipients of the grants from the CDC to install smoke alarms. And there's other programs that went along with that, but it helps you understand how they arrived at that information. So that's an excellent article. I would have to look to make sure. I don't believe there's test questions on it. I hesitate to say that because it's a pretty easy read. And it's very, very informative as far as helping to design that program. So your written assignment is going to be that intervention strategies for your home community project for what you are doing in there. So look at that and it'll give you the directions for designing those strategies and taking care of that. So this is an important piece where when we think about designing these intervention strategies, we do need to have a specific target audience in mind. We need to have, as a part of our team, either members of that target audience, the stakeholders, or people that work with that target audience, because what we may be proposing as an intervention, for example, smoke alarms, installing smoke alarms could be an intervention to prevent fire deaths. So a lot of things go along with that. How can are we going to be able to get into these people's homes? Are they going to allow us to do that? If we're having a problem in our communities with child passenger safety, who do we need to partner with to be successful, to help us understand? I know in working with the Hispanic population, they really wanted their children to be safe when we were talking about child passenger safety, but they didn't know the rules about child passenger safety. I can remember doing one car seat check where the mama had this. I swear this kid was 18 months old and he was huge in a just a regular carrier seat that was designed to be rear facing, and his feet were hanging off and his head was hanging off. But her intentions were good. And so we have to figure out how we're going to best implement these. And we talk about that in kind of the next section is the implementation of these strategies. But what is it that we want to do? What is it that we have identified in our community? Fires, again, child passenger safety. It might be drunk driving. That may be a problem. It might be, I don't want to say gun control because that brings up a whole political issue, but gun safety as far as kids are concerned. Bike safety, all of those things um, could be an issue, could be a problem in your community. And you may want to make sure you have the right stakeholders, that you have the right target audience, and that target audience is who is this happening to? Who is experiencing this issue? Who is having this experience? So that's where we can better focus and make a better difference in our communities. It is not a one size fits all. So by going through this process, and when we're looking at our intervention strategies, we don't want to leave anything out. Maybe it is a legislative issue. Maybe and those are things that you're in there for the long haul for. But or maybe it is training up our personnel, whether it's law enforcement, whether it's fire, whether it's EMS, to help identify situations, to prevent them, or to respond to them in a more efficient manner. It could be a lot of different things. So the door's kind of open to that. But this is where we are getting some of this on paper. I would encourage you to look at the references and see how those can help you out. As always, if you have questions, problems, suggestions, please let me know. I'm going to try to divide the resources section into module folders, and that may help that even better, be better organized for you. But take advantage of those resources. And if you find a really good one, please let me know, and we can add it to our resource reference list. But this is module 3. We're going to identify and develop intervention strategies. And then in the next module, we're going to look at the implementation, and then we're going to look at evaluation. And by the end of this semester, you're going to have your own project together. So how exciting is that? Thanks so much. And again, let me know if you have any questions or problems. Thanks for your time.